Good evening, everyone, and thank you all for joining us for this important and timely event addressing current challenges faced by America's small businesses and what a road to recovery may look like. As people across the country and beyond grapple with the acute realities of police brutality and systemic inequalities set amidst an invisible and deadly pandemic, at PAAIA, we continue to give deep thought to the role we play to keep our community informed and engaged in the national discourse. We also work to highlight the tremendous response of Iranian Americans to support patients, customers, neighbors, family, and their larger communities during these crises. As the far-reaching impacts of COVID-19 dominates us all, tonight's event addresses the brutal impact of the pandemic on small business owners and entrepreneurs, of which the Iranian American community boasts a significant number, along with the uncertainty and instability of what the future holds. According to a recent study, immigrants are overrepresented among small business owners and account for 30% of all small business growth. The Iranian American community is strongly represented in this powerful economic engine of entrepreneurs that collectively employ 59 million people, create 2/3 of net new jobs, and account for 44% of US economic activity, and that's according to the Small Business Administration. Our panelists will discuss the uncertain future America's entrepreneurs face as they struggle to keep their businesses afloat in an environment of new health rules and fewer customers, and the inadequate federal government relief responses to the crisis. We have assembled an excellent panel of Iranian American small business owners and attorneys to share their real-time experiences and offer solutions toward a road to recovery. I'm now going to introduce tonight's moderator. I'm pleased to introduce Roben Farzad. Roben is the host of NPR's Full Disclosure and is a regular contributor to NPR, C-SPAN, and the PBS NewsHour. He was previously at Bloomberg Business Week, where he covered Wall Street, international finance, and Latin America. Roben is also a graduate of Princeton University and Harvard Business School. Take it away, Roben.
خیلی ممنون. یک دنیا تشکر. خانم, I'm just so grateful that you had me. How much time is allotted for the ta'aruf and the self-flagellation? I don't see it anywhere in the agenda. خانم, I have a face for radio. ببین, I'm not good for webinar. در هر صورت, thank you so much for having me. I'm so giddy to be here. As you know, I'm a big Amuz fanboy. Chef Sep knows that I've been up there, like, you know, gaining 15 pounds during quarantine. He's about an hour and 50 minutes away from me. And I have like no ta'aruf at all when I go in there. I just, بدون خجالت, I just get everything. His food is delicious. His kashk badem jun is why my wife is still married to me. So I'm grateful to be here tonight. Look, from a business journalist perspective, we're going into this year, everything is hunky-dory. Except if you guys remember, we were very nearly going to start World War III with Iran. That's such a distant memory going back. But unemployment was at a 60-year low. The stock market was at an all-time high. There were murmurs about this flu-like virus coming from the Wuhan province in China, but we never thought it would affect us. And then it really walloped us. And in short order, it's so crazy. The stock market fell upwards of 30, 35%. In short order, we had 25 million people filing for unemployment in very short order in like whiplashing fashion. You had small businesses frozen out, people who never really planned for anything like this. The last time we truly had experienced anything on the actuarial tables like this was the Great Flu of 1918. So everybody's blindsided, including my friend Seb. You know, he was becoming very resourceful. He was, you know, in addition to masking and social distancing, you have to hit social media, you have to hustle, you have to have your menu out there. He had to break out all of his different wine bottles and offer that just to keep cash flow coming in. So I've been fascinated, and my show has kind of covered a lot of the emergency contorting for people to figure out how exactly to survive in an environment like that. And I think about Dr. Kiani Manesh, and the dentist is really like in your face. And did you even have any training about N95 masks in dental school and these COVID type sports? It's really, truly blindsided all of us. And it's forced us, as you know, as small business owners, Jay, Cyrus, that, to apply for the PPP loans, to kind of get your head around, do I furlough people? So anyway, long and short is it's caused this kind of crash course small business MBA for millions and millions of small business owners. And I have them on my show, and they're still confused, and they don't know, even if the governor tells you that it's safe to open up, does your staff want to come back? A lot of staff is in limbo. They're still taking the excess, unemployment benefits. This is truly an unprecedented time for everyone. So we kind of want to, get to some of these subjects and take Q&A as much as you can. If you see, Layla and others on the screen, forgive me, I'm using my iPhone because we had some Zoom trouble. But if you'd like to lob in Q&A or email us as well, I'll be connected to PAAIA. So with that said, I'd like to introduce the panelists. You have Agha Seb Ovaisi, owner and executive chef of Amu's House of Kebab. The only other reason to go to Chainbridge Road other than Capital One, Agha. It's so good. I expect to go in there. I was like, Agha, you don't give me thought leadership discount when I go. I'm like, no, I'm not Master Brani. I'm not, Jason Rezayan. I'm like a discount celebrity there, so I don't get anything. But he knows I love his food. I text him all the time. I live in Richmond, which is nearly 2 hours, but I'm there as much as I can be. We have Jay Angoff and Cyrus Mary from Mary and Scale It PLLC. We also have Dr. Anita Kiani Manesh, owner and founder of Purple Plum Dentistry. I mean, you get to talk to a restaurant owner, you get to talk to a dentist. Let's do the back and forth. I'm going to kick it off to Dr. Anita. Are you there? Can you hear me? Can you unmute?
Yes, there we go. Can you hear me?
Yeah.
All right, perfect.
Look, Khanam, I'm a failure in the eyes of my mother because I did not become a doctor. She's like, what is journalist? They pay you by commission? What is? چیه بابا؟ چرا نرفتین دکتر بشید؟ Like, you put me here with a vakil and a doctor, so of course, Khanam, congratulations on being doctor. Was this ever brought up in med school? Was this ever brought up kind of in best practices? Like, when did you realize this was a dead serious thing? One, you're going to have to shut down the business, and two, finally when the CDC and WHO and everybody got around to saying it's actually significantly conveyed through breathing and masks, that you realize, wow, you are in the face of your patients.
Yeah, so basically in dental school, obviously they teach us universal precautions. So dentistry, as you know, is one of the highest risks professions. So we're in touch with a lot of viruses. So if it's not COVID, it's the flu. There is, hepatitis, there's HIV, there's all the other things that we deal with on a daily basis. But of course, you kind of get into the comfort of your practice, and people have been practicing even the OSHA, and there's a lot of guidelines, and having maximum, no skin exposure and things like that. A lot of offices have been so relaxed about it. As far as showing skin, a lot of people practice with their scrubs, short sleeves, and things like that. So basically, yes, no, I had never actually heard of a K95 or a KN95 mask before this time. So obviously we wear our regular mask and loops and things like that. So it was a very stressful time for all of us trying to figure out, like you said, dentistry was one of the top professions that we were very afraid that they're going to shut us down, and when can we come back, and can we even come back for any time soon. There was a lot of webinars, and dentists, actually, I was very proud of the dental community. They came together really in an organized manner. We had a lot of Zoom meetings and webinars, and many people sharing information, which was wonderful. A lot of leaders in the dental world were also giving guidance, which was great. The ADA took a little time. Many dentists were actually very disappointed that we didn't have guidance coming from American Dental Association, which all of us actually look for guidance from them. It took a little while before they actually came out and said, okay, this is the guideline. You can, when you do reopen, you need to have these things in place, and also CDC as well. So we kind of had to gather all that information. I can't hear you, Roben. You got to unmute. There we go. You're muted again.
What is your staff? How big?
How big is it? I have 4 W-2 employees, including myself, and I have 3 1099 doctors.
And what kind of insurance, in addition to the typical insurance that a physician's practice would have, did you have? Is there ever any accounting for business interrupted insurance?
So that's something that we were actually discussing with Jay, and many offices just have the regular office policy. And when this happened, that I understood that you could actually apply for this business interruption insurance, but a lot of policies unfortunately said COVID is not part of the things that you can claim, which obviously nobody knew about COVID. So there's no way that it could have been, you know, noted in there. So many people got denied when they did put a, you know, claim in, they got denied, unfortunately.
May I ask you quickly, بدون خجالت, because, you know, my show is called Full Disclosure. What did you do from a cash flow perspective when you realized you were going to have to shut down?
Yeah, the cash flow, I think any business that has 20 employees or less was more in danger with this COVID situation, because the cash flow is always a problem. You don't have a big capital, or you kind of go month by month as you produce money, you reinvest in your business, you're buying things, and you're kind of reinvesting in your own business. So that was very tough, actually. We had to figure out what things we could reduce as far as the cost, and what could not be reduced. Telecommunication stuff, such as obviously we have a lot of automatic basically systems in place to talk to our patients. So that was something that we had to keep. Our website we had to keep, because this is the only way that we could communicate to our patients. And then I did a lot of research to figure out how I could offer virtual consults. You cannot really work from home when you're a dentist. So I did take some calls, and, you know, video calls of patients showing me things, and I was able to log in from home. I was actually answering, because all my employees, unfortunately, I had to furlough. So I was actually logging in to my patients' charts, you know, remotely. I was able to kind of semi-diagnose things and help them, and so they don't feel abandoned basically during this time.
And Dr. John, I just want to know, you talk about furloughing people. Everybody has this elusive topic of strategic unemployment right now. The government has, in some respects, according to some senators, been very generous with backstopping the economy. You put aside the Federal Reserve and the stock market and everything else, to the point that some small business owners are saying they're having a hard time convincing their furloughed employees to come back for limited hours, when unemployment plus the bonus is more generous than the alternative.
Absolutely. This has been a topic of discussion in all the dental forums. Many people, unfortunately, have had problems bringing their staff back. I was lucky enough, I have a smaller, kind of tight-knit staff at my office. I was lucky that everybody was able to come back, but I also was lucky to be able to secure the PPP, or Paycheck Protection Program. I don't know, I'm sure you're going to touch on that. According to the CARES Act and all that, dental offices were able to get, amongst other small businesses, the PPP loan, which is to basically, the sole purpose of it was to be able to bring your employees back and offer them very close to what they were getting paid prior of going on furlough. And the challenges with that is that a lot of my colleagues that got the money, they were supposed to spend it within the 8 weeks, and they were not even able to open because of the mandate, the state mandate. For example, state of like Washington, D.C., they weren't allowed to open. So if you got the money and you only have eight weeks to spend it, that kind of didn't make sense, you know, so that was kind of a challenge. And I understand that now the law has been passed by Senate and the House, that they're extending the 8 weeks. until December, or I guess however many weeks that it takes to be able to give more time for businesses to be able to spend it. Another challenge was that the 75% to 25% ratio, because you had to spend 75% on payroll, 25% on other things such as rent, utilities, any basically interest billed from the loans that you had. And that wasn't sufficient because many people were not able to bring their employees back. So payroll, you know, they couldn't spend it on payroll as much. So I guess the new extended, and also they changed the ratio from 75%, I believe, to 60% to payroll. So that's going to be a little bit helpful.
I want to move to Chef Seb. Sir, if you can unmute. You have it over there?
Got it. Okay.
Aga, I am a big fan. I brought Sharpie marker. Sorry. I'm curious because we've done episodes on the full service restaurant. Like your infrastructure has now become an albatross. The dining room, which is packed on Fridays, on Saturdays, on Thursdays. Now suddenly you have to hustle, get as much contactless carry out, and you're working your food truck as well. And social media and catering. So tell us how you immediately contorted
all of it. So here's the thing. With the restaurant, we're very lucky because, Amos has been there since the early 2000s and it's very established. And, especially the location where the restaurant is, we are surrounded by about 2.5 mile radius of very wealthy residential communities. And therefore, so that's kind of working out for our benefit. So we had a lot of these families, even before the COVID-19, they were already grabbing, food for dinner and lunch on a weekly basis. So we have this established revenue that's been there for years. What happened when COVID-19 happened and they mandated the dining rooms for the dining rooms to close, we lost 60 to 65% of our revenue in total, but we increased our sales with our carry out to goes. And I reached out to Postmates, which is a third party affiliate company. They kind of similar to DoorDash or Uber Eats. We signed up with them and integrated our app with their website so people can order delivery for those folks that live within 2 mile radius of the restaurant.
Time out. Isn't that notoriously expensive? The Postmates, the DoorDash, they're all getting knocked.
Under normal circumstances, they it is relatively expensive, because now, because when you have a regular business, you still have the dining room and you have revenue that's coming from that. And with all the other restaurants that are open and with all the competition that are around, it's not cost effective for you to sign up with Postmates, or at least for us, it wasn't. Like before this, I had no intention of doing any type of DoorDash or Uber Eats or Postmates, because the way I looked at it as if we were to start doing delivery, what would happen? The customers are already coming in for carryouts. They're just going to switch to delivery. So essentially, we're just changing the format of how this food is being served to the customer versus actually increasing the sales. So under normal circumstances, it wasn't a very smart move for us. But when COVID-19 happened, I started, advertising on social media for the delivery service through Postmates. Postmates just charges a fee from the customer to do the delivery. So under the current program that I have with them, we don't pay them anything outside of what they charge the customer. They reached out. Offered multiple different programs, or a lot more extended programs, such as like bringing the terminal POS to the restaurant, have a system that gives us we get the orders directly, but we refuse because the system is already working for us. It's there and people are using it. So,
Chef, I have a question. Did you guys put in for any sort of rent relief? This was a notorious tension in March between the restaurants and the landlords. And two, tell me about PPP and maybe an SBA loan or some other things that you might have availed yourself of.
Well, because as I was saying earlier, because the restaurant's been there for over 15 years, our rent has been with the same landlord for that same amount of time. So lucky for us, our rent hasn't really increased, and because it hasn't really increased, it's still very affordable for us for the location that we are in. And with the business that we got coming in, with the amount of revenue that we got coming in at this very moment, I didn't feel like I needed to do anything to get any type of incentive as far as the rent goes, because I wanted to keep it current. I don't want to touch it. If I can pay it, I'm just gonna pay it. That's as far as the PPP. We didn't get that until about 5-6 weeks after the pandemic hit. And by then I was already working my magic and figuring things out based on all the new stuff that we implemented, such as the delivery, the food trucks, and the HOAs.
Does everybody see what a Shah Dumas this guy is? The Los Angeles Lakers put in for PPP, but Amuz didn't.
Honestly, I'm very lucky. Like I said, I'm very grateful. We're definitely one of the very, very lucky ones. Okay. I mean, we did use the PPP, but I used it to pay the payrolls for the staff. So it did help, but it wasn't the life-saving help. Like if my restaurant was completely shut down and I had no revenue coming in from nowhere, the PPP would have not saved us. It was only enough to make 1 or 2 payrolls. So I'm actually really, really glad that my family and I, we sat down and we started to figuring out strategy on our own versus relying on a government assistant or relying on anything else. Because this way, at least I know it's, I'm the one who's going to have to deal with everything, and I don't have to worry about a debt later.
Sebastian, just in closing, what percentage, even after all the hustle, the food truck, the Postmates, the carry out, what percentage of sales fallen since pre?
Well, initially we were down to 65%. Okay, we lost 65% of our revenue. Now it's starting to, as people are starting to go back out again, the numbers are starting to go back up. So right now we're down by 40%, 40% total.
Okay. All right, very good. So quick, I would like to go to Cyrus John. Can you hear me?
Hi there. Yeah, I can hear you. Good to see you.
Yes. Is it, do you prefer I say Cyrus or Cyrus? I like
either one is fine. I'll take either.
Could I please ask you, the big question I have is, who the heck, I found out that Wimbledon had, through dumb luck, been paying 25 years of pandemic insurance, and they got to collect when they had to cancel. But I don't know anybody else who, if an insurance salesman came up to me and said, you need to buy this, the 100-year one is going to hit. What kind of advice have you guys given clients over the years, or who sells that insurance, and moreover, what's going to be sold going forward?
Well, first of all, thank you for having me. I think my colleague Jay Angoff is really the guru on insurance. He is a former state insurance commissioner, but since this pandemic broke out and we see all these small businesses struggling to survive, one of the things that we were happy to do is to try to create a lifeline. So we've been looking at very small business owners are sending us their insurance policies, studying them. And for your specific question, apparently after the SARS epidemic happened, the companies started to put in virus exclusions on many policies, probably the majority of them. So then if that's going to be out there, then you have to offer a small number of companies, and Jay could speak to us better than me, have put out there, oh, you can actually bargain for the pandemic or virus kind of exclusion. So there are a small number of companies that, not exclusion, but coverage. A small number of companies, and a rare situation like Wimbledon where they actually offered and accepted coverage for this. But that's extraordinarily rare.
Were you guys
most of the time?
Did anybody ever market it to you? Did anybody ever market it to you as a veteran small business person?
Oh no, absolutely not. I mean, but you got to keep in mind, like almost all small business people get a policy. It's 200 pages long. It's designed to confuse, designed to talk about disclosure. It's lack of disclosure. It's obfuscate. And so no one really knows what they're buying. That's part of the problem when they get insurance. And so I don't think as a business owner, I paid attention to it.
Am I allowed to pivot back and forth?
Yeah, go ahead.
Is it possible?
Yeah, go ahead. Yeah.
Jay, what can you tell me about insurance? And by extension, I mean, the secondary and tertiary effects of this biblically calamitous year. You have rioting now. And, you know, in my town, in downtowns everywhere, looting, business interruption has kind of taken on a whole other meaning.
Yeah, most policies do provide coverage for riot and commotion. So if anybody who's listening, who's watching, has had their business damaged as a result of rioting, looting in the past couple of weeks, there's a good chance that you can get some compensation under your policy. It's important to keep good records, but on the question of whether you can recover for riot and commotion, in general, the answer is yes. Whether you can be compensated under your policy for the loss of income that you've experienced as a result of your business having to close down, the answer to that question varies a lot based on the specific provisions in your policy. Robin, as you recognize, there are some policies, there are very few, but there are some policies that expressly provide coverage for pandemics, like the policy that the Wimbledon Lawn and Garden Club, or whatever the heck you call it, bought. But for the average small businessman, whether Iranian or any other type of businessman or businesswoman, it's unlikely, very unlikely, that your policy expressly provides coverage for injury caused by a pandemic. On the other hand, most policies do offer at least a possibility of recovery, because the test is for whether or not you can recover for your lost business income is, have you experienced physical loss, or has your property had physical loss or damage? Has there been physical loss or damage to your property? And so the question is, does the coronavirus cause physical loss or damage? Obviously, it doesn't cause structural damage, but just as obviously, it is on surfaces for some amount of time. We can argue about how long it stays. And the consensus seems to be that people can catch the coronavirus, both as a result of other people breathing and coughing, and also as a result of touching surfaces that the coronavirus is on. So there's a chance. It's going to be argued. I mean, obviously the industry argues that unless there is tangible, visible physical damage, there's no coverage. But there is an argument. There's a good argument that the coronavirus does cause physical loss or damage, and under many policies, therefore, you can recover. Now, on the other hand, just as on the one hand, there are policies that expressly provide coverage for injury caused by pandemics, there are also policies that expressly exclude coverage for injury caused by pandemics. And so, as I think Cyrus mentioned, our firm is looking at policies from whoever wants to send them to us, and we will go over those policies and analyze them and determine whether or not there's a reasonable chance of recovery under those policies. Going through those policies and trying to understand them is a damn nuisance, because the insurance companies make it deliberately difficult for policyholders to understand what's in them. There's an underlying policy. There are a bunch of endorsements that amend the policy. There are a bunch of exclusions, which exclude certain coverage from the policy. And a lot of times you have to put them in different piles. You put the underlying policy in one pile, put the endorsements in another, the exclusion in the other, and they all relate to each other. And together they can amount to hundreds of pages. And so, as I said, it's a nuisance determining whether there's coverage. But if there is coverage, we'd like to go to bat for the people for whom we think that, who have a policy that would give us a fighting chance of getting coverage.
You know, Jay, Cyrus, the year 2020 and all of these calamities, eviscerated my sense of humor and joie de vivre. I tried to build this all to Anthem Health Insurance. I say, your mental health benefits should make me whole. My product has been marginalized. They haven't returned my emails.
Roben,
It's hard to get people to respond these days.
I know.
you seem to have plenty of joie de vivre to me.
No, I used to be a contender. Let me ask you, what's going to happen with insurance after this? Now, people have been really chastened, and it's very sharp and pungent in their memory. Suppose we go to 90% capacity, full capacity, and you have this PTSD raw in your memory. Who's going to sell it? Are you hearing of people, Jay, insurers that are going to make a market in this?
Oh, heck yeah. I mean, there's always insurance to be sold at a certain premium. And so what the insurers argue is, what the insurers are arguing in court essentially is, okay, if you hold us responsible for this, for damages caused by the coronavirus, we'll pay. We don't think we should, but if you do that, we're going to have to raise our rates a lot in the future for this coverage. On the other hand, Roben, look at the bright side, because I know that's what you want to do. Look at the people who buy auto insurance. Auto insurers, at least some of them, are reducing their rates because people drive less because of what's happened because of the coronavirus. So some insurers, for certain types of coverage, auto, maybe workers' comp, if insurers have not voluntarily reduced your rates, you should ask them. If you're driving 80% less than you have in the past, if you've got workers' comp coverage but people aren't coming to work, you should be paying less than the insurance companies originally were charging you. So try to get some of that money back.
Dr. Anita, did you get forbearance on your insurance? Did they put it on ice while your business was closed?
No, they did not. So I guess kind of expanding on what Seb was talking about, like with his line of business, I guess there's not as much loss when you don't have revenue coming in. Unfortunately, with a dental practice, there's a lot of overhead involved. There's multiple insurances, malpractice, there is office insurance, there's all these different insurances that we pay for, and you still have to continue paying the premiums. And there's many other fees associated that we could not put a stop on. So our overhead is extremely high for a dental practice. And if your insurance, like a PPO practice, we continue getting some checks because everything is usually on a kind of 1 month behind cycle. So we shut down in March. So for the first 2-3 weeks, we had some money coming in because this was the back money from the checks that insurance was sending in. But basically beyond that, once we shut down for 2.5 months, there was really no revenue coming in. And we had so many fixed costs as far as, that's starting from lease, insurances, everything, that really we couldn't put on hold.
Can I break in and give Anita some personal advice?
Go ahead.
Okay, medical malpractice is a perfect example. You've got medical malpractice insurance, but if you're closed down, you can't practice, mal or not. So they ought to be giving you a rebate for the amount, for the number of months that you haven't been able to practice.
So is this something that you could actually recommend us writing to them and asking for that, or is
Absolutely.
On the back end? Okay.
There can't be any malpractice if there's no practice.
Right.
I was talking, Jay or Cyrus or anybody who wants to jump in, I was talking to a small business owner here recently had on the show, who she has trepidation about people being over litigious in the wake of COVID, that if she does open up and say, God forbid, an employee contracts COVID or a customer, even after they've taken all the precautions, how is the community even going to approach that? Or how can you insure yourself against that? How can somebody make the case? Even if you showed that you did all the best practices with PPE and deep cleaning, I mean, this is a brave, new, terrifying world.
Yeah, it is. That's a different type of insurance. And the good news for a business owner is it's very difficult for to prove that who gets the coronavirus, to prove that that facility or that business caused the coronavirus. It could have happened. Who knows where they got the coronavirus? So I mean, that's not to say that business owners shouldn't be as careful as they possibly can, take as many precautions as they possibly can, but it's a very difficult case for an injured individual who contracted to prove that there was one specific cause of getting it.
Robin, I just like to address it just from the business owner point of view and the stresses that business owners are under with a firm of 15 to 20 people. When March rolled around, as you said, it snuck up on everybody and we were walloped by it. It was a lot of stress to figure out how do we safely represent our clients and transition to going remote. Now we're fully remote, operating very well, getting work done for our clients, which is, you know, an advantage of being a law firm versus a dentist or restaurant owner. But it's a lot of stress to think about, what about reopening? So right now we can go back to work, but we're still operating remotely, because I know if people go back to work, it's very hard to keep people away from the 6 feet away. In fact, that's kind of the purpose of being in work, is in the same office, is to be in conference rooms together and be in the same offices together. And so now I feel erring on the side of being cautious, but that's because as a law firm, we have more ability to do that than some other businesses.
Well, I personally, I myself personally, when it came to the business, I had a very good conversation with my family in regards to when would be the appropriate time to reopen up. And honestly, because I haven't seen a unifying approach within the country, within the government, within our leaders. So it's sad for me to say this, but I feel like I cannot rely on what the government puts out as far as directions as to what to do next. So for us, we're following more people like Dr. Fauci, Dr. Birx, people that are more scientific based. And I personally, I don't feel comfortable with opening our dining room unless there is either a vaccine, treatment, or there is a major decrease in the numbers. You know, with the age of social media, with the age of internet, you know, the last thing I need is a bad story gets out there that's, you know, that has a moose or my food truck involved. So I personally, I'm just gonna wait, because if we're able to sustain like this, I'd rather have a longevity doing what we're doing and what's working for us now than trying to open up, you know, in a hurry, and we're going to be forced to be shut down again because God forbid somebody got sick. So that's just us. I mean, I can't speak for other businesses, but that's how we feel.
Dr. Anita, may I ask what this has done to the cost basis of labor in the dental industry? Like, I'm imagining if I'm a hygienist right now, I mean, my job description is significantly more dangerous. And I don't think anybody wants to stick it to you necessarily, but I hear, you know, grocery store owners have been talking about this. Various people who are face-to-face with other people, tattoo artists have been talking about this. What are your perspectives on that?
So from the cost perspective, obviously our costs have really, you know, we have very high costs now for personal protective equipment. Yeah. It was very difficult to secure initially, because obviously hospitals and nursing homes and other people that were in need. In fact, I actually donated some masks to a nursing home because we were shut down. We couldn't use our masks that we already had. So, and they were more in need at that time. But during this 2 months that we were closed, everybody was stressing, trying to, you know, secure masks, shields, and gowns, and so many different things that we have to now incorporate. There's new things that we have to actually use, that basically something called a dry shield that we put inside the mouth for cleanings to minimize the aerosol production. And this is a whole different step, different materials that it's a lot of cost. I ordered some Medify units, HEPA filter, you know, to kind of put it in the rooms to decrease the aerosols as well. So there's tremendous amount of cost, and some practices, basically the American Dental Association put a statement out saying that dentists should be able to charge a code for PPE to their patients. It could range anywhere from $10 to $30. And so I've heard a lot of negative backlash from patients going on news, on social media or a news outlet complaining and saying that they didn't appreciate being charged $10 extra because they feel like this should be part of the dental cleaning of your office. You shouldn't be charged extra. My comment to that is that obviously, yes, if a mask costs less than $1, then yes, then there's no extra cost. If one individual mask is going to cost me $10 or $6, then at this point, with dental insurance is cutting the profit margins already by 20%. If on top of that, I'm going to have to come extra out of pocket, and imagine this is not just for me, this is for all my doctors, my staff members, everybody's going to need a KN95 mask, a surgical mask on top of it. We need a shield, we need a gown. All of this is new to us, and this needs to be changed if you have availability. Now, the CDC has said some recommendations of if you don't have availability, then it's okay to use the same mask underneath as long as you're changing the masks on top. However, it's still a challenge. We still can only order 3 boxes of masks per week, so they're rationing the masks. So there's everybody kind of has this, I guess, fear of what if, we continue to be open and we run out of supplies and we really cannot see, our patients. So that's been a real, I personally have not been charging my patients. We've been submitting the code to the insurance companies in the hopes that they would slowly, pick up on that and start paying. But I really don't know, I guess, which end of the spectrum is right. It is costing offices about $10 to $20 per patient more. And on top of it, we're not able to see the number of patients that we were seeing. On a regular day, if you had a hygiene schedule, doctor's schedule, and another doctor's schedule, now we can only run one patient at a time. We have to have staggered entry. We cannot have a waiting room. So patients call us from the car. They come in, we have the whole protocol, take their temperature, fill out paperwork. So it takes literally twice as long to get the same thing done. And some of these insurances are ridiculous with their reimbursements. For a cleaning, for a dental hygiene appointment, they pay $50, $60. You mentioned hygienists, the cost of the hourly cost of a hygienist in this area is about $53. So already prior to COVID, it was a loss for us. A cleaning with a hygienist for $55, if your hygienist is getting $53, was already a loss by the time you take into consideration all the other materials we're losing. After COVID, it's really just become a huge problem. So dentists in general, I guess, need to get together and basically have insurance companies raise the compensation for our services.
We have a question in from a viewer. Does anyone have advice for small business owners that have most of their employees opt to come into the office, and an employee that is high risk or lives with someone high risk that argues they can do work from home and has actually shown that over the past several weeks? How about the challenge of an employee that has not been as productive from home over the last several weeks? Also, should employers be considering whether or not they have children at home? Arguably, how can they care for their children and also work 8 hours? That's loaded, but take it on, anybody.
Wow, there's a lot in there. I'd give it a try from someone who runs a firm. It's tough. I mean, one of the reasons why I said earlier that it's a very stressful situation is because I know some of my colleagues have spouses that are compromised from health issues, so you feel like you have to go that extra mile to be meticulous. We also, one thing about being a law firm, which is kind of an unhappy part of being in the law firm, is we keep track of our time, what we did for this client, what we did for that client. So there is ways to check people's productivity. But one of the things that happened for us is that we were really thinking a lot about office space because our lease is coming up in a year or so. So we had already done a survey for people about what they like or don't like about their office, and we're going to be able to do that again in a month or two because we'll have had the experience of working virtually, get a lot of people's feedback. So I look at it as ultimately an opportunity to have a vision of how you can reconcile all these competing things of what a post-COVID law firm office looks like. And you have to be very mindful of these various factors that was mentioned in that question, the health risks of some family members, what family members could bring into the office, what people's productivity is. So I think just having good systems, and I think one of the key parts of this moment in history for small business owners is being creative, being adaptable, and having good systems, which is a lot of what you heard from the other speakers tonight.
Hey, Seb, I have a wild card question for you.
Yes, sir.
In knowing that we are a culture of tarof, and that you didn't even hit up your landlords for relief, how do you broach generous tips with customers? I mean, now people, I call in delivery after people have pleaded, not delivery, but contactless carryout. And in addition to sometimes the mandatory, 20% surcharge embedded, they do ask you when you're giving the credit card number, and would you like to leave a tip?
To be honest with you, as far as the tip, the area where the restaurant is and where I operate the food truck, we are we're lucky we interact with a lot of generous folks that live in the area. So for most part, I think, and generally speaking, everybody was very, very generous towards small businesses. So the COVID-19 happened. I didn't really change anything as far as adding automatic gratuity to any of our checks because I just felt like that was unnecessary. And all of our customers that came in, they've really been super nice. They left a generous amount of gratuity for all of our staff, and I've been splitting it between everybody. So no, it's been relatively helpful for these guys, especially the guys that are working in the kitchen, because what I did with my front of the house staff, like the servers, I pretty much converted them into to-go and carry-out personnel. So they're the ones that are wrapping up the to-goes and the carry-outs, like sanitizing all the containers, wiping all the bags, all that good stuff. Because there's a lot of side work that goes into the job before you open up for the shift, just to make sure that all of the sanitation routines are being practiced. So the extra work that they're doing, it's really helping with sustaining the business. So the gratuity that's coming in, and when you give these gratuities to these individuals, it's really puts a smile on their faces, because right now they need every single penny. But as far as doing anything different with gratuities and that, or adding service charges or anything like that, I didn't feel like that was necessary for us. I know other businesses have done it, but for us, I just didn't feel like that was needed.
Okay. I'd like to open it up to everybody. Freestyle. I'll still take questions. You forgive me if you join late. I've had to use this my iPhone because for some reason Zoom was freezing on my laptop. So I've been tapping the little tiny question button. So you can also email your questions in through Emily, or if you'd like to ask, Brady Bunch style back and forth. I'm here to help. Wow.
You want from us, Robin? You want us?
I do.
I thought you were going to ask for the questions. Okay.
No, I'm looking at.
Well, I just say something that Layla talked about this earlier about the dire situation small businesses are in, but that I'm proud to be part of the Iranian American small business community, and I think one reason I think we have a better chance, maybe, or a fighting chance to survive all these dynamics, is that being an immigrant population, you're by definition already adapting. These are generations of people that are adapting to a new culture, new worlds, new dynamics. So I think we're well positioned to be creative and come up with some of the solutions to survive during an unprecedented time that's like 1918, 1933, and 1968, all in 1 year combined in 2020, meaning pandemics, depression, and unrest. It's all happening in this year. So we're going to have to be on the top of our game to be creative and solution oriented. And I feel like we're a good community to make it through somehow. And that's what we're trying to do.
No,
May I just
absolutely
go ahead.
I was gonna say I absolutely agree. I definitely don't. And I know I've been talking about how lucky we have been. I just don't want people to get this idea that we haven't been dealing with the hardship of COVID-19, because we did. What happened, I had to actually work around the clock, make sure that we come up with plans to how to save my business. So it wasn't like, oh, you know what, we're fine. But customers are still flowing in. Nothing's gonna happen to us. I actually had to sit down with my sister, come up with different plans on how to attract markets that we've never really tapped into. I started calling the HOAs, all the HOAs around Washington, D.C. Metro, and asking them if they need a mobile vendor in their neighborhood, since they can go out to restaurants. And I didn't know how that was going to work out for me, but it ended up becoming my main source of revenue right now. That's keeping our head above water. My point is,
I give you revenue. Yeah. I give you revenue. I've been telling you for years. Come and bring your trucking job.
No. Anytime, anytime, Roben, anytime. Let me know, man. I'll be there. But no, my point is that you can't, like, if you're just gonna, if you're gonna sit down and say, you know what, I don't know what to do, freak out or rely on other people, you're probably gonna end up not doing a whole lot of, you're making a whole lot of moves. But if you actually make plans for yourself, sit down and talk to your staff, talk to your management, talk to your co-partners, and figure out a plan on how to sustain. I think most people will be surprised how creative they can be at times like this.
Hey, Jay, Cyrus, we do have a question. If you could provide your contact information for people with business insurance questions.
Sure. I think the easiest is probably to email us, cmehri@findjustice.com. That's my email, and it's 202-822-5100. I'm thankfully not the one doing the deep dive on people's policies, so the person you really need to send your policy to is Jay. So I'll turn it over to Jay to give his contact.
Okay, I mean, it's fine with me, Cyrus, if you get them and send them to me, but if people want my personal email, it's jay.angoff@findjustice, all one word, findjustice.com.
And it's find with a D, F-I-N-D.
Jay, there's somebody asking about the reasonable expectation doctrine, not to be confused with the Monroe Doctrine.
Sure, well,
could you explain that?
Yeah, they're very similar. But what the reasonable expectations doctrine says is that a policy should be interpreted consistently with the reasonable expectations of the policyholder. So if a policy is written in a very convoluted, complicated way, and if you read the policy literally, it appears that the policy does not provide coverage, that interpretation is not necessarily going to be adopted by a court if the policyholder's reasonable expectations based on a reasonable person's reading of the policy would lead to another result. The insurance companies draft these policies. They're not negotiated between the average small business person and a big insurance company. Insurance companies draft them. And so the policy, in case of doubt, the policy is interpreted against the insurance company and in favor of the policyholder. So again, that's why it's so important to look at the specific terms of the policy, the specific language of the policy, because it can come to different results based on different policies.
Any thoughts in the few minutes we have left on the Chamber of Commerce pushing for liability protections, I think in the next, or corporate liability protections in the next potential stimulus that comes down the pike?
Well, Jay's actually an expert on this stuff too, but I'll just say one quick comment on that, is that it's my understanding that that's holding up legislation that could help small businesses. I just wish they would just focus on getting relief. This is an emergency situation out to small businesses and other government agencies, state and local, dire straits. So anyway, Jay, you're a guru on this one too, so I'll turn it over to you on that one.
Well, we represent injured people. So obviously, as a firm that represents injured people, we are not in favor of legislation that would prevent people who are injured from recovering.
Okay. All right. I open it up if there are any more questions that want to come in, or Emily, I have your emails. What changes do you see to be permanent in your businesses, and what do you think is temporary? Dr. Anita, if you want to address that.
The temporary changes obviously is our very reduced schedule. I'm hoping that, slowly as things get better, as Seb mentioned, hopefully the vaccine becomes available, or, the numbers start dropping. And I'm actually, to be honest with you, I'm actually even surprised with the amount of requests for appointments that we have. I really did not anticipate. I was actually afraid that once we open, no one's going to want to come to a dental office. So people are coming, and to be honest with you, I look across the way, I'm on the 14th floor of the Skyline building, so I can see the shopping center, and it used to be empty. There was a giant there, and now apparently other stores are open, so people are out and about. And my worry is that, just by people just being careless and going to these stores, like Burlington had a 70% off. I don't think that's a necessity. I understand dentistry is more urgent, but I don't think, certain things are as urgent, but people putting each other in danger. And I'm afraid to be able to go into a second phase of this. And I don't think a lot of businesses are going to be able to survive a second phase of closure and coming out of that. So that's.
And I totally agree with that. And that's why the whole PPE, when the industry were talking about it, I didn't want to put all my eggs into that one basket because, Dr. Fauci and other health experts, they've all have said it's pretty inevitable that we're going to have the second wave. And, to me, the first wave wasn't really handled well. I just hope that we learned some lessons and we can learn from our mistakes, so we can definitely deal with the second wave better. And I certainly hope we do that. But no, I totally agree with you. I just hope we can make smarter decisions so we can get over this sooner than later.
So I think, Roben, that I'm sure you're getting this from all the people you're interviewing, that the business world, the legal world, so much of the white collar world, you might say, of complex businesses, they're going to change forever in terms of fewer road trips, fewer in-person things, a lot more work being done remotely, smaller offices, more people working virtually. So I think this is a transformative event of what's going to happen in the business world going forward. Post-COVID.
All right. Look, everybody, I really appreciate this. Thank you for letting me act like the Persian game show host I always wanted to be.
There's always a chance for changing your career, Roben. Who knows? Something could break on that.
Yeah, no, this is the last stand for me in journalism. If it's not, I need to open a Cholo Kebab. I have such an idea, Sim. You have to call me. So
trust me, after tonight, I now realize I have found the job that I'm supposed to be doing. I'm not very good at these like webinars, all these like online stuff. I'm great at the kitchen. You know what I mean? I'm so nervous.
Your Tajik will save the world.
Great stuff. Yeah, hopefully after all of this is. Yeah, I was going to say, after all of this is over, hopefully the chef will host a kebab party for all of us, right?
Absolutely. Without, you have my word. You have my word. As soon as I'm allowed to open up the dining room safely, like actually safely, I would be more than happy to have everybody there for a nice dinner.
You can be patient. We'll be patient. Before we close, I wanted to thank you all so much. Extend a huge thank you to all of you, our panelists, our wonderful moderator, for joining us tonight and for sharing your stories and expertise. I want to remind all the viewers that we have actually put Jay and Cyrus's information in the chat box. So if you wanted to share your policies with them and see where you can benefit, please do so. And finally, this was PAAIA's third webinar addressing post-COVID challenges and experiences of our community. We welcome your thoughts and ideas for future conversations. Please email those either to Emily, whose email is in there, or to info@paaia.org, PAAIA.org. Thank you all and stay safe.
Thank you.
Thank you guys. Nice meeting you.
Thanks, everybody.
Bye, guys.
Good night.